So let's have a quick look at firstly how some of the numbers are moving in terms of the spread of the virus, and then update on how the major economies are dealing with this, and some update obviously on South Africa and what our economic data looks like. So in terms of the spread of the virus, I think things have moved on, and we're trying to now evaluate which countries are able to deal with this more effectively and which countries are still facing significant risk in terms of the number of infections. So I think you can probably break this down into a couple of buckets. The first is that there are probably three major economies that stand out as having dealt with the spread of the virus very effectively right from the beginning. They've managed to keep the number of infections under control. They've also managed to reduce the number of active cases, and those three countries would be Australia, Germany, and South Korea. And I think they represent kind of the success story out there. And obviously each of those economies are now able to systematically remove some of the lockdown conditions and try and get their economy function. Then there's another set of countries that were very badly impacted by the virus, both in terms of the number of infections and particularly in terms of the number of deaths. But having been impacted, they've now made progress in controlling it. And so they're able to also start to remove some of the lockdown measures and try and get their economy function. And those countries would include Spain, France, to some extent Portugal. The UK is not in that bracket at the moment. So I think parts of Europe are able to now move ahead after having suffered a lot of deaths as a consequence of this. Then there's some countries that I think have managed this particularly badly and are still struggling. I would put the UK as part of that. They've made a little bit of progress, but I thought they managed it initially very badly. And then the US is kind of the standout feature in terms of their overall approach to it, their management, the misinformation, lack of clarity on policy, a whole range of things I think have gone wrong with the US response. And so obviously the number of deaths there have escalated quite substantially and continue to do so. And I would argue there's still upside risk. So for me, the epicenter of this virus is now moving. It's changing. Initially, obviously, it was China. It moved to Europe. Then it moved to the United States. And to some extent, the United States still represents the epicenter. But more and more, the discussion is moving towards some of the large emerging markets with big populations where the spread of the virus has gained a lot of momentum, and clearly there's upside risk. And there I would flag Brazil and Russia as being particularly part of that. India would have some risk. A country like Nigeria would also have some risk. For South Africa, obviously going into the lockdown early did help us. It gave us some time to try and get our healthcare system into slightly better shape. But you can see now that the numbers are accelerating quite substantially, and clearly there's upside risk to our numbers of infections. I think the benefit for us is that the degree of hospitalization remains under control, and the number of deaths remains, relatively speaking, fairly low. So I think we're coping at the moment with it, but there's no doubt that the infection numbers are going to pick up. Most countries are now moving into trying to ease some of the lockdown restrictions. That's not because the virus is miraculously under control. It's more to do with the economic and political pressure that emerges when you put economies into extended lockdowns. And I think South Africa, you can make a case that perhaps we went into a lockdown too early, given that you can't keep countries in lockdown for that long a time period. And even though our numbers are now accelerating, I think we've got no choice but to ease up on some of the lockdown conditions. So if you look at South Africa's numbers in terms of the average weekly increase, it clearly has accelerated. You can see the slowdown after the lockdown was initially introduced. That was obviously quite beneficial, but now accelerating at fairly rapid pace. Out of interest, the average age of people infected is now 38. The average age of people dying is 63. So I think South Africa definitely shows the typical pattern that's emerged internationally, and that is people who are older tend to be more susceptible, and clearly people with underlying health conditions, obviously a lot more susceptible. The other area of focus is the development of vaccines, and most people are surprised when I tell them that more than 100 institutions around the world are busy with the process of trying to develop a vaccine. Out of those more than 100, 10 companies or 10 institutions in particular have moved into clinical trial phase, and out of those 10, 5 have moved into testing on humans. We're following all 5 of those, but I just wanted to highlight one of them, which is the development headed up by the Oxford University. There are other people involved in this, but initially their clinical trial focused on monkeys, a particular type of monkey that has a genetic structure that is fairly close to humans. They tested 6 monkeys, and the effect of their vaccine was very promising. So they've moved from that into a human trial. They started the human trial on the 23rd of April. They plan to test essentially 1,100 people. Not all of those people will be injected with the vaccine. Only half of them will be. The other half will be injected with a well-established vaccine as a trial or as a sort of offset measure. And then what they hope, bizarrely, is that as many people of those 1,100 become infected with COVID-19, and the more people that get infected, the more they're able to see whether or not their vaccine is effective. So they've commenced with that. Initially, they just injected 10 people, and they've moved on into a few hundred already, but they'll ramp it up to over 1,000 and then monitor to see how those people react. And if that trial goes successful, they'll expand it into a test of probably around 5,000 people. If that's successful, then they would be in a position to start to roll out the vaccine more globally. And at that point, it would be suggested that there's a workable vaccine. So quite a long road ahead. It is possible, if everything goes well with this particular vaccine, they would have it available by the end of the year. But I need to stress, everything would have to work exactly right in order for that to happen. Most people are suggesting realistically a vaccine may be available during the middle of next year. So we're watching all of that, and there are some promising developments, but nothing you would suggest is a major breakthrough right now.